Officials say a person in Jessamine County has a confirmed case of the measles linked to the revival at Asbury University.
That case has taken health officials by surprise, and now they're keeping an eye on any potential spread of this highly infectious disease. WKYT's Jeremy Toms spoke to Baptist Health's chief medical officer today. Our top story at 4:30.
Asbury University's revival services moved off campus last week after more than 2 weeks of continuous prayer. But before that could happen, measles made its way into the crowded Central Kentucky event on February 18th.
I've seen some of the videos from the revival, and it's kind of it was pretty full, a lot of close interactions.
Asbury requires its students to receive the 2-dose MMR vaccine. But with tens of thousands descending on the small town of Wilmore during those days, Dr. Lee Dossett says it's a cause for concern.
You have people coming in from across the state, from across the country, and so anybody that was there that day, or really any of the days, because it could potentially be spreading after that, we would check your vaccination status.
CDC data shows the measles vaccine is about 97% effective if you've received 2 doses, yet only about 86.5% of kindergarten-age Kentucky children have received it. That's below the national average of over 93%.
Or a lower vaccination rate does put everybody at risk, just because you don't have that herd immunity that protects everybody.
Dossett hopes this case can serve as a wake-up call for Kentucky's parents.
I've, to my knowledge, never seen a measles case in my career. The measles can make you pretty miserable. That's why it's so important. It's why we stress vaccines, is because it matters to people's everyday lives.
Jeremy Toms, WKYT.
And Asbury University released a statement Friday. It cited CDC recommendations saying that any unvaccinated individuals who were there on the 18th should quarantine for 21 days.